Ever feel like something's not quite right, but you can't put your finger on it? We all have those moments where we feel a little off or notice something unusual in our bodies. While some of these things are minor and temporary, others could be signs of something more serious, like cancer. Unfortunately, many women ignore these warning signals until it's too late. It's easy to brush off certain symptoms as stress, aging, or just bad luck. However, being in tune with your body and noticing changes early is crucial to catching health issues before they become more complicated. Here are 14 visible signs of cancer that women often overlook, ones you shouldn't ignore. Number 1. Unexplained weight loss. Are you dropping weight without even trying? While that might sound like a dream for some, it could actually be your body waving a red flag. Losing more than 10 pounds in a month without diet changes or extra exercise isn't normal. It could be a sign of cancer. Cancers like pancreatic, stomach, or lung often cause sudden weight loss because they steal energy from your body and mess with your metabolism. For example, if your clothes are getting loose and you're not doing anything differently, don't celebrate just yet. Schedule a checkup and find out what's going on inside. Number 2. Constant bloating. Are you feeling full, tight, or puffed up all the time, even when you haven't eaten much? Occasional bloating is normal, but constant bloating that sticks around for weeks could be a serious warning sign. Ovarian cancer in particular is known for causing prolonged abdominal bloating. You might notice your jeans getting snug or your stomach feeling heavy, even after a light meal. Some women say they look several months pregnant despite eating normally. If this sounds like you, it's more than just digestion. Your body might be telling you something important. Number 3. Skin changes. Are you spotting strange changes on your skin? Your body's outer layer can reveal deep inner problems. Watch out for new moles that suddenly change shape or color, or any spots that itch, bleed, or refuse to heal. These might be signs of melanoma or other skin cancers. But it's not just about moles. Darkened patches, yellowing skin, jaundice, or unusual rashes can sometimes point to cancers affecting the liver, kidneys, or immune system. If your skin is acting differently and it doesn't go away, don't ignore it. Get it checked. Number 4. Breast changes. Think breast cancer is just about finding a lump? Think again. Some of the most overlooked warning signs hide in plain sight. If you notice puckering, dimpling, or redness on the skin of your breast, or if one breast suddenly looks swollen or feels tender, it's time to pay attention. Watch your nipples too. Discharge, especially if it's bloody, inversion, or itching around the area, can all be silent alarms. These symptoms are easy to brush off, especially if there's no pain. But don't. Your body could be whispering a warning. Listen carefully. Number 5. Abnormal vaginal bleeding. Is your period suddenly acting out of character? Bleeding after menopause, spotting between periods, or unusually heavy flow isn't just annoying. It could be your body waving a big red flag. While hormonal changes or stress can affect your cycle, don't assume it's just that. These kinds of bleeding patterns are often linked to cervical, uterine, or ovarian cancer. If your period feels unfamiliar or out of control, don't hesitate. What might feel like an inconvenience today could be a clue to something much deeper tomorrow. Number 6. Chronic fatigue. Feel like you're dragging yourself through the day, even after a full night's sleep? This isn't your average tired. Cancer-related fatigue hits differently. It's bone-deep, relentless, and doesn't let up with rest. Tasks that used to be simple, like making lunch or going for a short walk, suddenly feel like climbing a mountain. This type of exhaustion can be one of the earliest signs of leukemia, colon cancer, or ovarian cancer. So if your energy has taken a nosedive for no clear reason, it's not just in your head. Your body might be fighting a hidden battle. Number 7. Persistent cough or hoarseness. Still coughing weeks after your cold is gone? That nagging tickle in your throat or the raspy voice that just won't bounce back might be more than just allergies or a dry throat. A chronic cough, especially if it's dry, deep, or brings up blood, can be an early sign of lung cancer. And hoarseness that lingers could point to cancer of the larynx or throat. Don't dismiss a voice that's changed for the worse or a cough that's overstaying its welcome. If your throat is speaking up, it's time to listen. Number 8. Changes in bathroom habits. Going to the bathroom may not be your favorite topic, but your body can reveal a lot through its routine. If you suddenly experience constipation, diarrhea, or notice blood in your stool or urine, don't just chalk it up to something you ate. These symptoms can be early signs of colon, kidney, or bladder cancer. Even subtle changes, like feeling you didn't completely empty your bowels, could mean something's off. Your gut health is one of your loudest messengers. If something's not right down there, trust your instincts and get it checked. Number 9. Unhealing sores or ulcers. A cut or sore that lingers far longer than it should might be waving a red flag. Whether it's a persistent ulcer inside your mouth or a skin lesion that refuses to close, non-healing wounds could be early signs of oral or skin cancer. This is especially important if you smoke or drink heavily. Those habits put you at higher risk. If you've got a sore that's stuck around for weeks or keeps coming back, don't just cover it up. It's time to let a doctor take a closer look. Number 10, unusual pain. Are you feeling pain that just won't quit and you can't even figure out why? We all deal with aches now and then, but when pain sticks around in one specific area without a clear reason, it could be your body's silent alarm. For example, persistent back pain isn't always about posture or a pulled muscle. It can sometimes be linked to ovarian or pancreatic cancer, especially if it doesn't ease with rest or meds. Don't ignore that mysterious ache just because it's manageable. If it lingers, it deserves your attention. Number 11, swollen lymph nodes. Ever notice a small lump in your neck, underarm, or groin and think, weird, but then brush it off? Those are lymph nodes, and when they swell without infection or pain, it could mean something more serious. Lymphoma, leukemia, or cancers that have spread can all trigger this kind of swelling. If your lymph nodes stay enlarged for more than a couple of weeks, feel firm, or keep getting bigger, it's time to stop guessing. Swollen nodes may seem harmless, but they can carry important messages about what's happening inside. Number 12, nail changes. Your nails are more than just a beauty statement. They can be tiny windows into your health. If you notice unusual changes like dark streaks that look like bruises, clubbing, where nails curve downward, or nails becoming unusually pale or yellow, don't overlook it. These could be subtle signs of serious issues including skin cancer, lung cancer, or liver problems. For instance, a black line under the nail might be melanoma. So next time you give yourself a manicure, take a moment to really look. Your nails might be trying to tell you something important. Number 13, difficulty swallowing. Struggling to swallow your food or feeling like it's getting stuck on the way down. That's not something to ignore, especially if it keeps happening. Difficulty swallowing, known as dysphagia, can be an early sign of esophageal or throat cancer. You might also experience pain, weight loss, or even choking episodes. Many people chalk this up to aging or acid reflux, but if it becomes persistent, it's best to see a doctor. Your body shouldn't have to fight to enjoy a simple meal. Make sure it's not a bigger issue. Number 14, persistent heartburn or indigestion. Sure, a spicy meal might lead to a little heartburn, but when it becomes a regular visitor, it's time to take notice. Frequent indigestion or a burning sensation in your chest, especially if it doesn't improve with medication or lifestyle changes, could be linked to stomach, throat, or even esophageal cancer. Don't just pop antacids and hope for the best. When your digestive system keeps crying out, it's your cue to listen and act. We all have busy lives, and it's easy to brush off small symptoms or assume they're nothing serious. But your body is always talking. You just have to listen. And if you found this helpful, don't forget to like, subscribe, and share it with someone who might need to hear this today. Your health is worth it.